Do you have the capabilities, or does your tissue body have the capabilities to even do those stimulus exercises? And I think that's important too. So as we're getting to this next section, this is where we're going to break apart the stimulus, intensity, and recovery. So when we look at the stimulus versus noise, this is where the signal sent matters much more, and a lot of this is based on the accommodation effect. It's also very similar for the SAID principle, specific adaptation to imposed demands. So there's a few things that can accommodate. It could be the intensity can accommodate, the tissues can accommodate, whether it's muscles, whether it's connective tissue. There's different means of progression for each person. There's other factors, whether it's a hormonal factor, whether it's someone has autoimmune, or whether someone has cognitive impairment, and then going to a genetic level as well, whether certain genes are turned on and off over a longer period of time. That will also affect the accommodation that person can acquire over time.
And what is accommodation, Doc, for those listening?
So accommodation is pretty much the body's biological energy saving response to similar and repetitive stimuli over time. So like the body can adapt to certain intensities, it can adapt to certain movements. That's why when you look at a cheerleader versus a football player, yes, one may be female, male, but you look at the training styles, you look at what's the demand required for each one, you're going to start noticing a bunch of different differences. There's a few similarities here and there, but you have to be very specific with your training as well.
Yep.
Now, let's take a step to the side to tackle it from this direction. Now, when you look at a person that is untrained versus trained, a person that is untrained, you're going to start noticing large growth effects really soon, whether it's someone working out for the first time or a patient that hasn't experienced any physical medicine, chiropractic work. You're going to start noticing, for most people, change of effect, whether it's range of motion, less pain earlier on. And then, like you said, that 80%, it's trying to get to that 20%. That's where it's the slow growth, ups and downs as the person gets better over time. So what signal are you sending? If they start noticing if someone's plateauing, whether it's there's certain people are working out, maybe it's 6 weeks later, a couple months later, they start plateauing. That's where you want to look to change the stimulus. Honestly, from day one, you want to make sure you change the stimulus, because the body can train in different periodic episodes or cycles throughout the year.
So do you like the idea of changing up the stimulus more frequently than like an 8-week program where you do something different, or you do something for 8 weeks and then you change it? You like the idea of maybe even every other session change the the stimulus.
Oh yeah.
Yeah.
And it depends. Like
maybe weekly or something.
If you want to train like power versus strength versus hypertrophy, that can be different than when you look at it from a day-to-day standpoint.
Sure.
And then you also have to think, what tissue are we specifically training per day? And we'll get into some of this here after a bit, but there's only so many resources for your body to heal, repair certain tissues. So if you do a full body workout, did you send the stimulus to where the intensity is at its highest form? And if so, maybe that tissue is adapting, but maybe you didn't send as big of a signal to another part of the body and it's draining the resources. And that's where you start noticing the person either goes into fatigue. So switching up can mean, let's say someone wants to work on their upper body power. If you work on like speed and strength at a similar time or in different focuses, you can still do that principle, but maybe one day is on the pecs and another day is on maybe the shoulders or something like that. And not just the shoulder, not just the anterior deltoid of the shoulder muscle, in the middle, the posterior. It's what specific line of tension within the 15-degree range are you trying to target in that small area. And that's the stimulus. That's the part that we want you to be very specific with and what you're trying to send.